Andre, and I will be talking on infant health monitoring with emphasis on ways to detect early stages of SIDS in a less intrusive manner. The motivation of this research is the need to continuously monitor infant health for any underlying health conditions, in this case, SIDS. First, I would like to start by defining what SIDS is. This is known as the sudden infant death syndrome. It is the sudden and unexplained death of a baby before age 1, with the highest risk being the second and between the second and the fourth month of birth. Therefore, early stage detection of any underlying condition that may lead to SIDS needs to be closely monitored. Identifying Identified risk factors include problem with brain functioning, problem with heart functioning, breathing problems, increased temperature, incorrect sleep posture, amongst others. There is no way of telling which baby would die of this syndrome, hence, proper monitoring of infants to get information about their vital health readings is of utmost importance. Ensuring that the correct sleep posture is taken and closely monitoring the temperature is also very important. To go further, I'll be reviewing two papers and lightly touching on an extra paper to show an innovative way babies can be monitored. The first paper focuses on understanding the impact of wearable devices for infants and how these devices directly affect parenting styles. The second paper presents a way to get all the required vital readings to detect early stage of SIDS. And lastly, the third paper presents a novel approach of monitoring infants using white noise generated from smart speakers like the Amazon Echo or the Google Home without direct contact with the infants. In the first paper, the authors introduces commercial commercially available infant wearable technologies and its role in parenting, as these devices provide mothers with various resources leading to a reduction of trial and error as a source of knowledge in the healthcare of an infant. The various modes of remote monitoring according to this paper include audio monitors, video monitors, sensor monitors, and wearable baby monitors. The paper provides an introduction to a commercially available wearable baby monitor, the Owlet, which comprises of a socket, a base station, and a companion mobile app that allows different types of visual and oral notification when an abnormal pattern is detected. This, de- this device detects the oxygen level, and heart rate of an infant during sleep. It is also capable of detecting movements of the baby. The authors argue that despite advancements in baby monitoring technologies, little is known about how these devices are used in the wild and their potential impact on parenting styles. To answer this, they carried an ethnographic research on 6 mothers. Through, through the study, they explored how the concept of a quantified baby might be realized by examining the use, non-use, and expectation for infants' wearable devices. Prior work in this field has led to an increase in exploring the role of technology in the context of motherhood and parenting, with Gibson et al. Exploring digital motherhood and Guns et al. Exploring the potential pitfall of applying quantified self approach to baby products. They both recommend that baby products should decrease parent anxiety, increase parental intuition, and provide a healthy social space between the parents and the child. With prior work in this field, there's little research on the use of baby monitors in the wild. Therefore, it is important to understand how these devices might directly affect parenting styles. To understand better the role to understand better the role of baby wearables, a study was carried out using contextual inquiries by applying contextual interviews, diary study, videos of out-of-box experiences. Participants were provided with the Owlet's baby monitor for 2 weeks for a 2 week study, which was carried out in different stages. First, they did a contextual entry interview to get demographical data. Next, they observed out of box experiences of participants to understand their perception of the products, while they performed a diary study to gain context of use. And finally, an exit interview to understand their experience using the product and its influence on parenting. The data was evaluated using an interpretive phenomenological analysis, which enabled them to apply qualitative methods to discover rich data from a small participant sample. This result, the result from the study showed that there was a strong correlation between device use and parenting styles, as participants described an impact on knowledge production and their participation and their perception of emotional, physical, and social aspect of parenting. As the device allowed access to new levels of health information of their infants, it also allowed getting relationship between health vitals and the baby's behavior, such as sleep patterns. It increased the curiosity level of parents to seek all possible health readings of their infants. It also went forward to reduce the anxiety level in understanding the infant's health. However, the limitations of the product was it did not provide all the required vital readings to detect early stage of SIDS, like the body temperature. The physicality of the device left the baby uncomfortable, making the device too intrusive. There was also a reduction of social interaction from the parents to the infants because they could not they could monitor the child remotely. Hence, there was no physical monitoring from the parents, which in turn led to an increased anxiety level due to frequent alarms from the device. In the second paper, its authors proposes a less intrusive health monitoring system that provides continuous health reading with the goal of reducing the response time in a SIDS scenario. They present the baby they present the baby night watch, which is a combination of emerging technologies to get continuous health readings of an infant. Based on the first paper in this presentation, it was evident that parents wanted an all-round health reading for their infants. Hence, this paper proposes a system that first provides a less intrusive way to monitor health vitals of an infant, monitors the temperature of the baby, monitors the heartbeat rate, monitors the breath rate, and the sleeping posture. This set of parameters are vital for identification of a SIDS scenario and the evaluation of the quality of sleep. The authors also developed an algorithm for the continuous monitoring of infants' posture during their sleep, as this is a strong risk factor in a SIDS scenario. The researchers argued that current modes of health tracking are intrusive and required direct skin contact, making them not suitable for prolonged use on infants. Hence, they propose the use of smart textiles, which offer greater freedom and comfort while capturing health data. The system comprised of a chest belt with textile electrodes for heart rate, contactless infrared sensor for temperature, and accelerometer to detect breathing and sleep posture. All of this fed wirelessly to the mobile phone through a base station that was customly built. To measure the heart rate, an Adafruit ECG sensor was used to measure the small biopotential signals, calculating the time difference between the ECG readings of two heart rates, which led to a high accuracy of the of detecting the heartbeat. The 3D accelerometer that was inbuilt was used to get data of the points XYZ axis, and a custom algorithm was applied to this to give an accurate sleep position. Also, the breathing rate was calculated using the same 3D accelerometer, and a smoothing algorithm was applied to get the points of inhale and exhale. And finally, and finally, an infrared thermopile sensor was applied to get the temperature without having direct contact with the infant's skin. The result of this research showed that the implementation was capable of detecting unexpected events and registering several psychological parameters, making it a powerful medical tool to monitor infant health in a less intrusive manner. It also proved that a small amount of hardware it also proved that with a small amount of hardware, various parameters can be read. Finally, the third paper takes a novel approach to monitoring the respiratory motion and detecting the cry of an infant completely contactless by using white noise generated by smart speakers like the Amazon Echo. The speakers would transmit this generated white noise, and this noise would get reflected off the baby's body and receive back on the smart speakers through its arrays of microphones. Using these methods, the system can be truly non-invasive as it doesn't require direct contact with the baby's skin. The key findings from all the papers that I've reviewed in this presentation are: no method of health monitoring is enough to provide accurate prevention of the SIDS syndrome. Hence, a combined method might increase the chance of timely response in a SIDS scenario. A more reliable way to monitor infant health is needed. Hence, more research has to be done in this field. And finally, continuous health recording is important to understand any underlying health factor that may lead to SIDS. Extending this concept introduced in this paper would be to utilize printable sensors, as this would reduce the size of the monitoring device drastically, making it less intrusive. I have added a link to a YouTube video that showcases the power of printed sensors you can view at your spare time. Also, the use of a reusable patch placed directly on the baby's skin might give a more accurate reading, as the case of the temp track that monitors the baby's temperature. Questions to think about in this research field would be: can proper health tracking be beneficial to parenting style? Even and even if the readings have a high accuracy, can it be relied solely upon to prevent SIDS in infants? Thank you.